This is Matt Walsh with your Minute with the Mayor for July 20th. Last Friday, Potawatomi County Public Health reported 18 new confirmed positive diagnoses. My understanding is that there were some technical difficulties at Iowa Department of Public Health over the weekend with patient reports, so we'll probably get those statistics from the weekend later today or tomorrow. In Council Bluffs' two hospitals, they have 54 adult patient beds available, 13 adult ICU beds available, and 36 ventilators available. There are 7 COVID patients hospitalized in Council Bluffs, and 4 of those patients are currently in the ICU unit. We have no outbreaks in our jail system, in our homeless shelters, or in our daycare facilities. In our senior care facilities, the state of Iowa does recognize Risen Sun as a location of an outbreak. It is my understanding that 3 residents have recently passed due to COVID-19 complications, and we remember their lives and express our condolences to their families. Local public health is working directly with Risen Sun on a daily basis. The facility has notified the families of all their residents, and it is following all guidance for bringing this situation under control. Early in the pandemic, scientists didn't know how easily this virus spreads between people with symptoms or how long infectious particles can linger in the air. There was a shortage of N95 respirators and face masks among healthcare workers who were quickly being overwhelmed by COVID-19 patients. Back then, both the World Health Organization and the CDC said face masks shouldn't be worn by healthy members of our general public and instead should be reserved for those who are sick or who were caring for the sick. Recently, Dr. Fauci, Surgeon General Jerome Adams, the CDC, and the World Health Organization have all done an about-face with mask guidance. In recent months, scientists have learned more about just how easily this new coronavirus can spread in the public. The virus can spread by just talking or breathing. Last Friday, we talked about SARS and MERS and just how deadly those coronaviruses were to those who became infected. But neither of those viruses were anywhere near as contagious as COVID-19. This coronavirus is highly contagious. Without mitigation efforts like stay-at-home orders, each person with the coronavirus infects an average of 2 to 3 other people. That makes it twice as contagious as the flu, and it's easy to spread the coronavirus without any symptoms, either from asymptomatic carriers or from pre-symptomatic carriers. This virus has a long incubation period of up to 14 days, giving a wide window of opportunity for people to affect others before they even know they're infected themselves. And carriers may be most contagious in the 48 hours before they get the symptoms, making the disease spread from community transmission even more blind to individuals who are directly involved. In other words, it's not just people who are sneezing and coughing that spread the coronavirus. It's often people who look completely normal and who don't have a fever, and that could include you. Cloth face coverings are meant to protect other people in case the wearer is unknowingly infected but does not have symptoms. For now, everyone should wear a cloth face cover when they go out into public, but mask wearing can be mutually beneficial. Your cloth face covering may protect them, and their cloth face covering may protect you. People with underlying chronic lung disease such as COPD or asthma should still be able to wear a non-N95 facial covering without affecting their oxygen or carbon dioxide levels. However, in some situations, people with intellectual or developmental disabilities, mental health conditions, or other sensory sensitivities, such as autism spectrum disorder, a mask could cause them distress. That's your Minute with the Mayor. Do something kind for somebody and wear a face covering when you go out in public.